My name is Catriona Waddington and I'm chair of the Expert Advisory Group for the Fleming Fund. And the Fleming Fund is a large UK aid programme about antimicrobial resistance, and it's managed through the Department of Health and Social Care. And the role of the Fleming Fund is to develop surveillance systems in 24 low and middle income countries. Our best estimate at the moment is that to run an AMR surveillance costs about £2.5 million per year. 2.5 million maybe doesn't sound like too much money. It's about what you spend in 6 months in a UK secondary school. But if we look at the government budgets of low-income countries for health, that 2.5 million represents all the spending, every single penny that you've got to spend on health for 430,000 people. So what might look cheap to some people is really expensive for countries. We're thinking that really AMR surveillance is a global public good, and so there's a real need for continuing international support for surveillance. We know that in countries with high payments, where people have to pay a lot for their health care, 2% of households every year are thrown into poverty because of healthcare costs. So if they didn't have to pay for healthcare, they wouldn't become poor. And I think that's one of the sort of forgotten reasons why it's important to work on AMR, because you can be sure that antimicrobial costs are a big part of that. The Fleming Fund initially has 10 years of funding. So we have to ask ourselves, after that, how are we going to sustain it? And we already know that it's very expensive for low-income country governments. One strategy, of course, the ideal is if governments take over spending for it. For example, in Timor-Leste, they're very gradually taking an increasing percentage of the costs of consumables. Year on year, they're paying for more and more of it. And the other thing we really look to governments to do is to create and fill skilled posts. We sort of try and institutionalise the surveillance, so if we can get the things that we need onto essential drugs lists and essential equipment lists, then that really helps to have it institutionalised, and if it's on the list, it will be bought. But I think realistically, we know that all the funding isn't going to come from government, so we're looking for continued UK government support, hopefully, and also to other partners, UN agencies, foundations, disease-specific organisations that perhaps feel that the achievements they've made are threatened by antimicrobial resistance. So I think we really need to make an ongoing global effort to keep this going.